Hello everyone, in this session we'll be learning about the median nerve from the anatomy decoded quick revision flowchart and the notes that we have made for you all. Okay, in the previous session we had covered about the ulnar nerve and we had provided the PDF to you all. In that same PDF, median nerve is also there. If you all have not accessed that, please access it from the link in the description box below. Okay, so let's begin with the median nerve now. So median nerve arises from which part of the brachial plexus? It arises from lateral cord as well as the medial cord of the brachial plexus. Okay, the lateral cord of brachial plexus gives rise to this lateral root of the median nerve, and the medial cord of brachial plexus gives rise to this medial root of the median nerve. Okay, lateral root has got this root value C5, C6, C7. Medial root has this root value C8 and T1. Okay, so the entire root value of median nerve becomes C5, C6, C7, C8 and T1. Okay, so it includes all the root value which forms the brachial plexus. Okay, so after it arises in the axilla, let's see what is the course of the median nerve. In the axilla, the median nerve lies lateral to the axillary artery. Okay, and then in the arm, the median nerve crosses the brachial artery from lateral to medial aspect. Okay, so initially it is present on the lateral aspect, and then it is crossing from lateral to the medial side. Okay, and then in the cubital fossa, it is the medial most content. Okay, if you read about the contents of cubital fossa, medial to lateral is the median nerve, then brachial artery, biceps tendon, and radial nerve, right? Then it enters the forearm by passing between the two heads of pronator teres muscle. Okay, and then in the forearm, it is present on the posterior surface of flexor digitorum superficialis muscle. Okay, it's one of the superficial muscle in the flexor compartment. It is the median nerve is said to be plastered under the surface of the flexor digitorum superficialis. Okay, and then it enters the hand by passing through a space called as carpal tunnel, which is deep to the flexor retinaculum. Okay, this is just a brief course of the median nerve, from where does it arise and then how does it go towards the hand. Okay, now let us learn about the branches of the median nerve. In axilla, it doesn't give any branch. In the arm, there is a branch given to the brachial artery. Then there is a branch given to this muscle. Branch to the pronator teres muscle is given in the arm proximal to the elbow joint. Okay, then branch to the elbow joint is also given at the level of the distal part of the arm. Okay, then many branches are given in the forearm. Let's see that. So in the forearm, there is flexor compartment which has got superficial and deep group. In the superficial group, there are 5 muscles, out of which 4 are supplied by the median nerve. Pronator teres branch was already given in the arm region. Then there is flexor carpi radialis, palmaris longus, flexor digitorum superficialis. Okay, so all these 4 muscles are supplied by the median nerve, except a muscle called as flexor carpi ulnaris. Okay, that is supplied by the ulnar nerve. Okay, so when we had learned about the ulnar nerve, we had learned this muscle flexor carpi ulnaris supplied by the ulnar nerve. Okay, remaining 4 superficial muscles are supplied by the median nerve. Okay, and deep muscles and flexor compartment, they are supplied by this branch of the median nerve called as anterior interosseous nerve. Okay, there is anterior interosseous nerve which supplies flexor pollicis longus muscle, the lateral half of flexor digitorum profundus, and pronator quadratus muscle. Okay, so deep muscles are supplied by the anterior interosseous nerve, except the medial half of flexor digitorum profundus. Okay, medial half is supplied by ulnar nerve, lateral half is supplied by median nerve. Okay, and then it enters the hand by passing through the carpal tunnel. And before it enters the hand, it gives one important branch. This is referred to as palmar cutaneous branch. Okay, branch is given proximal to the wrist joint, which supplies skin over the thenar eminence. There is an applied importance of it that we'll see. Okay, and then it gives branches to the thenar muscles, the 2 lumbricals, and skin over the lateral 3.5 digits. If you look at this diagram, lateral 3.5 digits and the palm region is supplied by the median nerve. Okay, And here three thenar muscles are written. Which are these three? One is abductor pollicis brevis, then opponens pollicis, and flexor pollicis brevis. Only half of it is supplied by median nerve. Okay, remaining half is supplied by ulnar nerve. Okay, so these muscles and these two lumbricals, all these are supplied by median nerve, and remaining all muscles of the hand, they are supplied by ulnar nerve. Okay, now let's learn about applied anatomy of the median nerve. Median nerve is also referred to as laborer's nerve. Why is it so? Because the majority of muscles in the flexor compartment of the forearm, they are supplied by the median nerve, which are used by the laborers for lifting heavy weights and all. Okay, so that's why it is referred to as laborer's nerve. Injury to the median nerve will lead to motor and sensory loss along the area of distribution of the nerve, and there is something called as benediction deformity. When the person tries to make a fist, the index finger and the middle finger are not flexed. Why? Because the lateral half of flexor digitorum profundus is supplied by the median nerve that is responsible for its flexion. Okay, so injury to the median nerve keeps these two fingers extended, index finger and the middle finger. Okay, so that position is referred to as benediction deformity. And ape thumb deformity, this is actually when the thenar muscles are affected, the adductor pollicis muscle is not affected. Okay, adductor pollicis muscle is supplied by ulnar nerve that will cause adduction of the thumb. That kind of position of the hand is referred to as ape thumb deformity. Okay, and what is pointing index finger? When there is injury of median nerve at the middle of the forearm, usually the radial head of flexor digitorum superficialis muscle that is affected. Okay, flexor digitorum superficialis muscle that we can see here, it has got a radial head and it has got a humero-ulnar head. Okay, and this humero-ulnar head is normal, but the radial head is affected. When the radial head of flexor digitorum superficialis is affected, the index finger is not able to flex. That condition is referred to as pointing index finger. Okay, and then there is a very important applied anatomy called as carpal tunnel syndrome. Just star mark this topic. There's a very important topic asked as a short note. And if median nerve is asked as a long question, then also you're supposed to write this. Okay. In this, what happens? There is compression of median nerve in the carpal tunnel. Okay. So what is the cause of this? Tenosynovitis of the flexor tendons. Okay. Many flexor tendons pass through the carpal tunnel. Infection of that can compress the median nerve. Dislocation of the lunate bone can compress the median nerve. If there is retention of fluid, usually occurs in pregnancy. Retention of fluid in the region of carpal tunnel that can compress the median nerve. Okay, basically the median nerve gets compressed and there are some symptoms. There is inability to oppose the thumb because opponent's pollicis muscle is affected. Okay, then weakness of the thenar muscles, then burning pain, pins and needles along the sensory distribution of the median nerve. Sensory distribution we can see here. Okay, the light green colored area. This dark green colored area is a branch which is given in the forearm. This area is not affected in carpal tunnel syndrome. Okay, that is written here. Skin over the thenar eminence is spared. Okay, why? Because the palmar cutaneous branch, this branch was given in the forearm. That's why whenever there is compression in at the level of carpal tunnel, this branch is spared. Okay. Then there is something called as positive Tinel sign and Fallon test. Tinel sign means tapping at the region of the uh, flexor retinaculum. It will reproduce the patient's symptoms. And Fallon's test, what is it? It is flexion of the both wrist joint against each other will reproduce the patient's symptoms. Okay, so these are some tests which are done to diagnose the carpal tunnel syndrome. Okay. So we have covered the median nerve from its origin, from its relations, branches, and applied anatomy. Okay, let's quickly see which headings we covered. So we started with the origin of the median nerve. The root value is C5, C6, C7, C8, and T1. Okay, the lateral root and the medial root of median nerve, they unite to form the median nerve. Okay, then important relations we saw in the axilla. The median nerve is lateral to the axillary artery in the middle of the arm. It crosses from lateral to the medial aspect. Okay, in the cubital fossa, it is the medial most content. Then it enters the forearm by passing between two heads of pronator teres. In the forearm, it is present behind the flexor digitorum superficialis. It enters the hand by passing through the carpal tunnel. Okay, then branches axilla. In axilla, there are no branches. In the arm, there is branch to the brachial artery, branch to the pronator teres, branch to the elbow joint. Okay, then in the forearm, maximum branches are there. Four superficial muscles are supplied by median nerve, and in deep muscles, all three are supplied by median nerve except the medial half of flexor digitorum profundus, that is supplied by ulnar nerve. Okay, the deep branch is referred to as anterior interosseous nerve. Then in applied anatomy, we saw how injury to the median nerve can uh, produce motor and sensory loss. Okay, then carpal tunnel syndrome, a very important applied anatomy that is there in median nerve. Okay, so do access this PDF from the link in the description box. Okay, thank you.